Hello. All right. So, welcome to another conversation with Swallow the Pill. My name is Zena. You guys know me by now. We've been doing this for a couple weeks now. So, I am your friendly nurse educator, and today we are going to have a conversation around diabetes. I just want to give you a little bit of information and a little bit of the knowledge that I have so that you can understand diabetes just a little bit better. Okay? So let's start with some basic lab work surrounding diabetes, right? Well, not even there. Let's start with what exactly is diabetes? What is associated with it? How do we get to diabetes? Diabetes is essentially the title that they give you once your blood sugar levels become too high. Once you have consistent blood sugar levels that are high and uncontrollable, or controllable but just high. And what exactly is a blood sugar level? Blood sugar level is synonymous with glucose. It is synonymous with sugar. You hear some people in the community, "Oh, my sugars is this, my sugars is that." So blood sugar, glucose, sugar are all the same thing. It is describing the level of glucose within your bloodstream. What does that mean? What is a blood sugar? Let's start with the normals. The normal blood sugar, if you are fasting non-diabetic, is 70 to 100. That is the level that you want to see whenever you check your blood sugar or whenever you're looking at your lab work. If you want to take it a step further, let's go to the hemoglobin A1C. What exactly is a hemoglobin A1C? Hemoglobin A1C is a lab value that they use to determine just how severe or just how managed your blood sugar levels are over a 3-month time frame. And what do I mean by managed? Your hemoglobin A1C will allow your doctor to know just how normal your blood sugar levels have been over a 3-month time frame. Are you consistently going above 100? Are you consistently staying within the range of 70 to 100? How controlled are you? The normal lab values for the hemoglobin A1C is as follows. So a normal hemoglobin A1C is 5.7 or less. That means great. Your blood sugars are controlled. They are managed. Diabetes is not even something that you should be concerned with. When you get to hemoglobin A1C levels of 5.8 to 6.4, then you are considered pre-diabetic. And what that means, we will discuss later in this video. And then when you get to seeing hemoglobin A1C levels of 6.5 or greater, that puts you in the category of where your doctor can diagnose you as being diabetic. And then we'll discuss that a little bit more as well. So I've given you diabetes, the lab levels that come with it, and then how doctors determine where you fall on what scale. So, in understanding diabetes, glucose, blood sugar, sugar, you also have to have an understanding of insulin and what does that term mean? Why does it even matter, the terminology of insulin? Well, they all coincide together. They all play in the sandbox together. The best way I can describe insulin for you, insulin is a hormone that is naturally produced by the body. Its primary job is to speak to glucose. Glucose primary job is to provide energy. It's an energy source for the body. It gives your body energy. But insulin is the top dog out of the two. Insulin steps on the scene, and its primary job is to talk to glucose. It tells glucose where to go and to activate. All right, glucose, you can't stay in the bloodstream. You need to go to those energy cells and provide energy. You got to clear out the space. You cannot sit here in the bloodstream. You got to go and do the job that you was designed to do. That is exactly what the job of insulin is. Insulin comes, it speaks directly to glucose, and it tells glucose exactly where to go and what to do. Now, in understanding the different levels of diabetes is understanding the relationship of insulin to glucose. So there's three different levels of diabetes that we're going to discuss. There's type 1, there's type 2, and there's pre-diabetes, pre-diabetic. We're going to discuss those three. So type 1, let's start with understanding what is happening with type 1 diabetes. Well, the easiest way for me to explain it is this. If you have been diagnosed as a type 1 diabetic, that means that your body does not naturally produce insulin. The easiest way for me to understand it is picture insulin as a principal. Insulin is the principal of a school, and glucose is the kids in the school. Well, in this scenario, you have the kids in the school just doing whatever they want to do, and the principal didn't show up to work that day. It just was like, you know, y'all, I'm gonna do my own thing. I don't even live here, I don't even work here. These kids is homeschooled, they doing their own thing, they got their own direction. The kids is just there in the hallway, the glucose is in the bloodstream, it's just chilling. It ain't got nobody telling it what to do. That is type 1 diabetes. There is no naturally produced insulin showing up on the scene, so glucose is just there doing its own thing. And in order for glucose to have some direction, those patients have to manually give themselves insulin. So these are the people that is injecting themselves with insulin. And that insulin will then come in and say, all right, glucose, time for y'all to go to y'all design jobs. Go and produce energy to those cells. Get out of the bloodstream. Stay away from the bloodstream. The bloodstream do not want you there. That is type 1 diabetes. All right, so type 2 diabetes, let's talk about it. So type 2 diabetes, the relationship of insulin and glucose is a little off. So insulin is there, glucose is there, but their conversation is not direct. Insulin might be talking, but it's not necessarily talking to glucose. Glucose is just kind of doing whatever it's want to do. It might hear what the insulin is saying, it might not. Another way to understand it, this is same scenario. It's a school. There's a principal. The insulin is the principal of the school, and the glucose is the kids. The glucose is out and about. They're in the hallways just doing their thing. They turning up, having a good time, fighting each other, beating each other up. And the principal is just scared to say something. The principal is one of those principals that don't know how to lead, that don't have a backbone to lead, to say, all right, y'all need to get out of here. Y'all need to go somewhere. Y'all need to get to class. Y'all need to go and do the job that you've been assigned to do. That is type 2 diabetes. Insulin is being produced, but it's not necessarily being produced in a certain direction to be able to directly speak to glucose. And glucose is there just doing its own thing. It might have direction, it might not. It might be actively sitting in the bloodstream. It might be actively going to the cells, but it just needs a little extra guidance. And in this scenario, there are pill form medications such as metformin that patients can take that can help to guide that glucose to where it needs to get to. That way, that glucose is not just sitting in the bloodstream, just sitting there hanging out. The pill form of medication gives the glucose direction, sends glucose to those cells, and the glucose gives those cells energy. All right, and then we have pre-diabetics. Not necessarily diagnosed as being diabetic yet, but the easiest way for me to explain this to you is there's insulin and there's glucose. And in this scenario, the glucose is there, the insulin is there, and they are talking to each other. They're talking to each other. But then there's a scenario where things just get overwhelmed. Like there's a lot of glucose And the insulin is just kind of like, hold on, wait. I can't handle all of y'all at one time. I can't. It's too many of y'all. It's too much of y'all. Like, I can't do my job with all of y'all. It's too much of y'all. I need a little extra help. I need a little extra help to be able to manage all of the glucose that's in the bloodstream. And the extra help that can come into play is a number of things. Now, in prediabetes, that is completely modifiable. It is completely modifiable by the patient. Now, when I say overwhelmed, what I mean by that is you could be overweight, you could be overeating, you could be taking in an abundance of sugary drinks such as soda. You can be taking in an abundance of carbohydrates, like you're eating bad, you're not eating good. You're taking in over the recommended dietary suggestions when it comes to your body. But you can use diet and exercise to control that, because here's the thing when it comes to diabetics and exercise. How does exercise help diabetics to improve? Well, when you exercise, it makes those cells more sensitive to receiving glucose. So when you exercise, it's like a big hug for the glucose to run into. It drives the glucose into those cells so then it can be energy like it was designed to be. I really hope that makes sense. So with diet and exercise, it gives prediabetes a chance to be reversed. And you lose the weight, you start eating healthier, you eliminate the soda, you eliminate the sugary drinks, you eliminate the additional sugar that your body is telling you, hey, I cannot handle all of this. Something has got to change. And things can turn it around to where you're no longer pre-diabetic and your blood sugar, your sugar is back to being controlled and back to being within normal ranges. Now, let's talk about what happens when these things are ignored, when these things are just like you don't even care, like you're not even paying attention to what your blood sugars are. As we talked about in the hypertension video, if you go back to the hypertension video, I talked about how the heart works, right? So if you don't pay attention to your glucose, your blood sugar, your sugar, and you just allow things just to remain as is, sugar sits in the bloodstream and it just hangs out. It's just there. It's kicking it. It's like, I ain't got nowhere to be. It's 7 p.m. on Friday. I ain't gonna go into global, but literally, but all jokes aside. So the glucose is just sitting in the bloodstream and it's not going anywhere. When there is an abundance of sugar sitting in the bloodstream, meaning it has not gone to the cells, it has not gone to do its job. Insulin has not come on board to say, hey, get your ass where you're supposed to be. It's just sitting there. Your bloodstream is then compromised. What do I mean by compromised? Glucose sitting in the bloodstream becomes sticky. It then becomes thick. Thick blood is not what you want, because thick blood then turns to clots. That then leads to strokes. That then leads to your heart having to work harder to pump blood forward. So if you have uncontrolled diabetes, you have glucose just sitting in your bloodstream, which then compromises your bloodstream, which then makes your heart work harder to pump thicker blood forward. Then it leads to your kidneys having to work harder to filter, because the blood is thicker. There's more in the blood for them to filter, which then can lead to kidney failure because your kidneys are having to overwork themselves, which then goes back to your heart because your heart is overworking itself, which then leads to heart failure. So unmanaged diabetes leads to heart failure, kidney failure. It puts you at a higher risk of stroke. It also puts you at a higher risk of infection, because bacteria, which is the source of infection, is drawn to glucose. So if you got glucose just sitting in your bloodstream, your risk for infection is higher. your ability to heal goes down, which is why oftentimes you see diabetics losing limbs. They're having to have issues with wound healing because glucose is just sitting there, it's drawing the bacteria, it's compromising your ability to heal, and it's compromising your ability for your body to move forward. It keeps you stagnant and stuck right there. So let's recap. Diabetes, aka whenever your body is telling you you have consistently high numbers of glucose just hanging out in your blood, it can lead to type 1 diabetes, which can be fatal if left untreated, type 2 diabetes, prediabetes, which then can lead to heart failure, kidney failure, stroke, compromised healing, and a higher risk of infection if left untreated. So I said that to say this. When is the last time you had your hemoglobin A1C drawn? When is the last time you've checked your blood sugar level? If you have a fear of going to the doctors, let me give you a cheat code. Go to CVS, go to Amazon, go to Walmart, order you a blood sugar machine. Check your blood sugar before you eat anything. Eat your meal, wait an hour or two, and then check your blood sugar after eating. See what it is. If your blood sugar is consistently above 120, that is a good sign you have issues with your body processing glucose. That's how we do it in the hospital. I'm giving you a cheat code. But in the hospital, if we saw that your blood sugar was high, we're going to give you some insulin to bring that down. But if you are at home and you see that, you need to call your doctor and have a conversation with your doctor. You also need to consult your doctor to discuss additional options. Can you put me on a medicine to get me down, get my blood sugar down until I can get my weight down? Can you give me more information and more education about this? Stop leaving things untreated, or stop getting to the point where you're not paying attention to your body, because you can fix things just by paying attention to what's happening to your body. Not paying attention to it is when things get bad, and then you get to the point of where it's out of hand, and then it's nothing you can do. But there's a lot of things you can pay attention to and you can catch beforehand and treat it beforehand before it's ever a problem. I hope this made sense. I hope this helped. I tried to simplify it in terms that I felt like you would understand. Um, if this helped you at all, leave me a comment, like, comment, and subscribe. And I will be back with another video.